And joining me now is someone who's become a household name during the pandemic, Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases. And I appreciate you joining me now, Dr. Fauci. I kind of want to start with where we are today.
The issue is we have 100 million people in the United States who are eligible to be vaccinated who have not gotten vaccinated. So everybody asks, what do we really need to do to get this pandemic under control? And the way we need to do it is we need to get more people vaccinated. We've done a good job right now with vaccinations. As we've said, we've gotten now about close 70% or so of the adults getting at least one shot. The elderly, we've done quite well. Of the elderly, we have over 80% of the population of elderly, namely 65 years of age or older, have received at least one dose. The younger individuals, particularly, we need to get vaccinated right now. And that's really the challenge as we go forward more now into the summer.
And you mentioned young people. A lot of attention is on the vaccination efforts, of course, and you mentioned those who are not, and specifically young people, and we know people of color as well. Why is that, and what would you say to some of those young people who would say, look, Dr. Fauci, I hear what you're saying, but I'm young, I'm healthy, I'm in the best time of my life. I don't need to be vaccinated. I can even beat coronavirus if I were to get it.
Well, first of all, as we know, and it's true, that statistically, if you are a young, healthy person and you have no underlying condition, the chances, if you get infected, of your having a severe outcome is considerably less than an elderly individual or someone who has an underlying condition. That's true. But that does not mean that young people are completely exempt from getting a severe infection. And in fact, if you look now throughout the country, with the surge that we're seeing of cases considerably higher than what they were a month and a half ago, we're having now a 7-day average of about 50,000 cases a day, which is considerably higher than what it was a couple of months ago. We're seeing a number of younger individuals who are who are getting infected and really requiring hospitalization. And in fact, if you go to many of the hospitals and intensive care units throughout the country, you will see young people there. Again, less likely than the elderly, but there are young people who are getting serious infection. The other thing is that even if you get mild symptoms, there's the possibility you might have what's called long COVID, which means even after you recover virologically from the infection, we're starting to see now percentages anywhere from 10% to 30% or more of people have the persistence of very troublesome and sometimes debilitating symptoms like profound fatigue, muscle aches, temperature dysregulation, brain fog, which is something that means you can't concentrate or focus very well. So I don't think young people should be comforted to think I have nothing to worry about.
For sure, Dr. Fauci, misinformation is one of the greatest obstacles in educating the public about COVID-19. What's the most dangerous piece of information floating around right now, and what is, if anything, we can do to combat that spread of misinformation?
Well, there's a lot of disinformation. For example, saying that the vaccine can make you sterile. That is absolutely not the case. So women infertile, that's absolutely not the case. And then there are really bizarre conspiracy theory things going around, like there's a chip in the vaccine that's going to control you if you get vaccinated. Those things are ridiculous. The best way to counter disinformation and misinformation is to provide correct information. And when you look at the science, look at the facts, you see you have a vaccine that's highly effective, even against the Delta variant, particularly in protecting you against severe disease. When people say, why should I get vaccinated? There's an extraordinarily striking statistic, and it's just data and fact. 99.5% of the deaths of COVID-19 in the United States are among unvaccinated people, and 0.5% are among vaccinated people. So if ever there was a real reason for a person to get vaccinated, just look at that statistic. You get vaccinated because you want to protect yourself from getting sick. You want to protect yourself from spreading it to others, including your family and your loved ones. And you want to be part of the solution to this pandemic issue that we're dealing with, not part of the propagation of it.
Those are some sobering numbers you're talking about there for people who are unvaccinated. I want to go back to mask mandates, Dr. Fauci. The CDC just announced a reversal of mask guidance, and now they're recommending that masks are worn indoors. And this back and forth we've kind of seen over the time, making it too confusing for some people. They say, you know, I'm here, I shouldn't wear masks, I should wear masks. I'm vaccinated, I don't have to. Where are we now when it comes to masks, whether it's people who are vaccinated or unvaccinated?
Well, for the people who understandably might be concerned and confused about it, it's the virus that's changing. And when the virus changes, then the science and the information and the data, which leads to the guidelines and recommendations, naturally have to change. So a few months ago, when we were dealing predominantly with the Alpha variant, it was very, very clear that if you were vaccinated, even if you had a breakthrough infection, and there will be breakthrough infections, a breakthrough infection means that you're vaccinated, but even though you're vaccinated, you get infected because no vaccine is 100% effective. And since it's not 100% effective, even if it's 90% effective, that means that if there are 10% that's not effective. So you're going to get breakthrough infections. But back with the Alpha variant, the fact that you were vaccinated means that the level of virus in your nasopharynx, which is the thing that allows it to spread to someone else, was significantly lower than the level of virus in the nasopharynx of an unvaccinated person who got infected. Now, with the Delta variant, that has changed in two ways. One, the Delta variant is much more efficient in transmitting from person to person. And two, when you measure the level of virus in the nasopharynx of a person who's been vaccinated but has a breakthrough infection, the level of virus in the nasopharynx is no different than the level of virus in the nasopharynx of an unvaccinated person, which goes along with what we're seeing, that even though if you're vaccinated and get infected, it's very unlikely that you're going to get a severe outcome. More likely, you're going to be either asymptomatic or only minimally symptomatic. However, what we do know now is that you can transmit the virus to someone else. And based on that, the CDC modified their recommendations and said, if you live in an area that has a high or a substantial amount of viral transmission, namely an orange or a red zone, according to the CDC map, then you should wear a mask when you're indoors, as opposed to the previous recommendation that said when you're indoors or outdoors, doesn't make any difference. You don't have to wear a mask. That's the thing that's changed.
Well, we will absolutely listen to that, and we'll keep an eye on it as well. We know new information keeps coming in. That's why we have you on the show. We appreciate it, Dr. Anthony Fauci, the nation's top doctor in the battle against COVID-19. We appreciate your time and what you're doing for the country. Thank you very much.
Thank you for having me.